environment where they don't see health professionals all the time. So health professionals will only stay because of the risk to themselves. So patients, it takes patients about 2 to 3 days to get accustomed to being in an isolation center, because the initial feeling is one of neglect, because you're not seeing a nurse, you're not seeing a doctor every 10 minutes, you're not seeing health professionals milling around on a ward. You don't see that in an isolation ward. All you see is your fellow patients, or if you're in a single room, you won't see anybody for about, except for 2 or 3 times a day. So people are not accustomed to that, and they grumble for the first 2 or 3 days, but then they get used to it. And, we explain to them that you are in isolation. Isolation means isolation.
Thank you so much. You have actually really given us a very vivid account. I'm sure most of our participants, those joining us live, will appreciate this very much, because in the media there are a lot of questions about what really is this isolation center all about. And people talk about the mental health challenges of being isolated and so on. So this very detailed explanation would really help even us to be able to counsel people, because as you said, there is a lot of resistance to going into isolation, the unknown.
Yes, exactly. And fear.
And fear, yes. So, Honorable Commissioner, sir, we have 15 minutes left on the clock, but I have reliable information that if we crave your indulgence, we might be able to get 15 minutes more, and I mean reliable. So I wanted to ask that, so that if you wouldn't mind, I could inform the viewers so that when we log out at the end of the hour, we could log in for just 15 more minutes. We have a lot we would like to discuss. I'm sure we won't finish it today, but at least we want to go far with it. So, sir?
Well, I'll give you that 15 minutes, but you'll have to give me something back in return. So I'll tell you what that is later.
Okay, then. Thank you very much. We appreciate that, sir. Thank you. So let me fire on to the next question now. This is a very sore point. Logistics, shortage of supplies, reagents, PPEs, and so on and so forth. So the issue of sustainability comes up. Let me add to this the issue of testing. Yesterday on the media, you said it costs between 40 to 50,000 naira per test. I think it sent a shockwave through our association to hear the cost of treating or managing COVID-19 patients. And we feel that this is definitely not sustainable. We don't know what models we can look at. I mean, we're still talking about rapid kits, not having found one that is reliable yet. And we are also, there's the Ghana model of pooling. I don't know. Even if we have private sector participation and donors, it's rather expensive. So what are the thoughts in terms of all these logistics, that is PPEs, the reagents, and so on and so forth, needed for this response?
Okay. So, the corona test is, the benchmark test is what we call the PCR, or the molecular biology test. It's looking for the genetic material of the virus, and either the material is there or it's not there. It's also very useful in terms of being not only 100% accurate, but it also can measure the viral load. So it gives us an idea of how much virus is in your system, or your viral burden. So it's a very valuable test, but it's a molecular test, and all molecular tests are expensive because they're carried out by molecular biologists who are far and few between. It takes a long time to become a molecular biologist, and you have to operate in a molecular biology environment, which is also a very expensive environment. And the reagents for carrying out molecular biology tests are extremely expensive. And they're broken down into 3 parts. There's the swab, the viral transport medium, the genetic material extraction medium, and then the PCR medium. So there are several components to running a molecular biology test. And none of these components is cheap. So when you add all these up, it amounts to between 40 and 50,000 naira per test if you add the cost of your personnel and your overheads and things like that. You may be able to run the test for, say, between 20 and 30,000 if you're just calculating the cost of reagents alone.
Okay.
Now, when you look at, there's a global shortage of these reagents. So the forces of supply and demand kick in. So when there's a big demand on a finite resource, the price goes up. So what we could have possibly bought for 1,000 naira pre-COVID, you now find that those same reagents are costing 2,000 naira because of the supply and demand principle. But what we've been trying to do in Lagos is to manufacture some of those reagents ourselves. So we've started working on the first reagent, which is the viral transport medium. We've successfully done that. We're now working on the RNA extraction kit. We're halfway there. We're already running some tests using the viral extraction homemade kit. But the PCR mix is a little bit more complicated, and we still rely on importing that from various reputable manufacturers. So when you put all that together, if you really want to do a test where you can categorically say you either have COVID or you don't have COVID, then you need a molecular test, and a molecular test is expensive. So when the population keeps saying test, 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 if we test at the speed at which people want us to test, you're going to bankrupt the government because we just are not able to run those tests free of charge at the rate at which the outbreak is expanding. Which is why we're thinking about some models now that bring in insurance, bring in subsidies, bring in private sector demand, corporate demand, and so that there's a way in which we're sharing the cost of performing these tests. Now that will bring us to an inevitable question, which is the use of the rapid diagnostic test. And the rapid diagnostic test is very useful, provided you can find one that is accurate in this environment. Now, a rapid diagnostic test can be accurate in England and be totally inaccurate in Nigeria because of the environmental factors, So we might have many pathogens in our environment that would cross-react with the reagent. So they don't have as much salmonella, or they don't have as many corona species in England as we do in Africa. There's malaria, there's typhoid, there's E. coli. There are all kinds of other pathogens here that could give a false positive on a rapid diagnostic test. So even if you transpose a test from the UK to Nigeria, you have to validate it here as well. So we're going through the process of validation here. There's so many of them on the market, and some of them are so inaccurate, and some of them are reasonably accurate. So we're trying to find the ones that are reasonably accurate, because the consequences of a wrong diagnosis, a false positive or false negative, can be severe. So you want a rapid diagnostic test that is as close to the benchmark as possible. And that test has advantages. One, is slightly cheaper, and two, the result is instantaneous. So you can use it in multiple settings to make the management of a COVID patient or, social activities. For example, you want to get on a flight, you can do a rapid test on a patient or on a traveler, and you either qualify or you don't qualify to get onto that plane. Or you have a flight that's coming into the country, you can use that to quickly screen the travelers and decide who can go home or who can go into isolation. So those are some of the scenarios in which we are trying to manage the testing. So when the public tell government, your testing is too low, you need to expand your testing, you have to look at the dynamics of testing, the cost of testing, the logistics, the manpower, the availability of appropriate molecular biology labs, you know, and you have to put all that into the context. Lagos is not doing too badly. We're testing by far more than any other part of the country, but we're not testing enough. And we're going to increase our testing repertoire in the next couple of weeks, because we have some ideas that we're trying to roll out, which will make testing a little bit more sustainable and a little bit more widely available for patients that need it. Now, there's a difference between the need to test and the want to test. You know, there are people that we need to test, and they are the public health response. You're not well, you need to be tested. Now, someone like you may just wish to know if you're positive, and that's a want to know. You know, it's not a priority for us, you know. So our priority is to test those that need to be tested, not test those for peace of mind, you know. So that's an important factor to also remember.
Thank you so much. For want of time, we have about 6 minutes left. But first of all, I want to say that I'm sure that all our, you know, viewers or participants appreciate what Lagos State has done so far, and that we have a response at least that we can say is well structured. And we are just looking at it being further strengthened to be able to position itself for what we envisage is coming in the, you know, next few days to weeks. So thank you, sir. I'm going to say, read out the next question, and I'll let you know when the time is, you know, about to go off, so that we can re-log on. And once again, we appreciate the additional time. So I'd like to talk about other services. Now, we know that the government has not stopped rendering services. And we have a lot of programs: malaria, immunization, vaccine preventable diseases, family planning, HIV, tuberculosis, and these are very important diseases. We have other infectious diseases as well, ravaging the country, such as Lassa fever. Now, the question is, there have been so many, there have been several reports of incidents of people falling out of care, either not being able to access care for non-COVID issues, or being suspected to have COVID when in fact they're trying to access care for other issues. And as a result of this, we've seen some, well, unfortunate loss of life and some near misses as well. How can we strengthen the health system at this emergency time to ensure that people who need care get it? People who need to be tested for COVID-19, that is those who actually are ill or who have contact with ill people, are actually tested. And that we make sure that 6 months or 1 year down the line, we're not looking at an epidemic of measles, for example.
Okay, so that's a really important question, and it's something that the government is spending a lot of time trying to figure out how to not neglect non-COVID pathology. So the first thing that the incident commander did, which is Mr. Governor Babajide Sanwo-Olu, was to make care in our general public facilities, in our secondary healthcare facilities and primary healthcare facilities free of charge. So that would not discourage people from coming to those facilities. And in fact, we saw an increase in participation at all our healthcare facilities because of that gesture from the governor. And he's extended that for another month. So we're still in a month of free healthcare in Lagos. And that's in an effort to ensure that non-COVID disease is not neglected while we're diverting a lot of our attention to managing COVID. We're ensuring that a reasonable number of our healthcare professionals are still dedicated to non-COVID-19 pathology. The other strategy we're using, and I mentioned that earlier, is that we're not using any of our secondary healthcare facilities for COVID management except the infectious disease hospital in Yaba. All the other 26.
Sir, can I just interrupt now and say that we need to save now and relog in so that we don't lose this recording. Thank you so much. And please, I'd just like to ask all participants, please just log right back on. Thank you. Thank you very much.
Okay.